greet you all, and as we mark these holidays coming and prepare for a holiday, we must not forget that we are in the middle of a massive global pandemic which has taken many lives, and where the virus will not be taking a holiday. We must therefore not let down our guard, must continue to be as vigilant as possible. Look at the figures of other countries, we shudder and shake. We have been lucky to have been spared such bad figures so far, but must not take anything for granted. As far as our country is concerned, our surveillance and contact tracing and testing capacity is increasing gradually in all states as more laboratories come aboard. I would like to use the opportunity here to call on all our state governors and leaders and FCT to increase the number of surveillance teams and isolation and treatment capacity to keep pace. I was also a member of the, to able to take part today at the National Economic Council. I have an interaction with their excellencies in which I had the opportunity to speak also on the COVID-19 pandemic. We have developed more key performance indicators to track surveillance and strategic directions and programs. As of this morning, we have recorded 6,677 confirmed cases in 34 states and the Federal Capital Territory, out of which 1,840 have been successfully treated and discharged. Sadly, we have recorded about 200 deaths in 25 states and the Federal Capital Territory. A finding from the analysis of the death patterns shows 70% to 30% for male and female, around that ratio. And about 70% of fatalities were persons over 60 years old, while majority of positives were between the ages of 29 and 49. Those are the most active ages in life. I also advise those who are taking the test and are awaiting result to heed the advisory to self-isolate yourselves in your homes until you get your result, and in order to be able to save your friends and your family, wear masks and observe hand and respiratory hygiene until your result is out, so that your community and those around you will not necessarily be exposed. We are scaling up training of health workers on infection prevention and control, and so infection among healthcare workers is gradually reducing. In Kano, the training has been scaled even to patent and proprietary medicine vendors, and retraining is now a continuous process to be sustained so that nobody will forget the protocols for this very highly infectious disease. State-level infection prevention and control measures and training are being carried out working with partners, and has also been standardized to be stepped down to community level. The fact-finding team of the Ministry of Health that went to Calabar has returned successfully with a report, and we have been able to identify areas of strength and areas that are in need of upgrade, including laboratory infrastructure. The state of readiness of the state against COVID-19 is reasonable and includes setting up of COVID-19 task force, production of PPEs, face masks, of which samples were presented to our team and will be forwarded to NAFDAC for validation. The areas of strength and weaknesses, as said, are still being analyzed so as to improve federal cross-river state collaboration and support. The critical findings is that no case of COVID-19 has still been reported as at 20th May 2020 when the team returned to Abuja. 16 cases had been tested, of which all were negative, and 28 persons of interest had been followed up, of which none of them presented any symptoms after completion of their 14 days of self-quarantine. And the testing center, there are no other testing centers established in the state as yet. We are going to be working with the state to establish protocols and improve communication and reporting to our reporting centers here in Abuja. Our team in Kano has made a very successful trip now to Gombe on fact-finding mission. After to Borno, the reports from these states are being awaited so that we can streamline the response and provide more targeted support. A new medical team has been assembled to take over the management of this day dome isolation center, which was donated to the government by the private sector. And the very comprehensive treatment for second, third and level treatment, these machines, ventilators, and waste disposal. Admissions will start at any time now. Of the threatened industrial action in Lagos State among doctors, I spoke with the president of the Lagos chapter of the association yesterday evening to dissuade the doctors from the planned that they will conduct. And I also listened to their complaints about harassment at security checkpoints. I communicated this to Minister of Lagos State, Commissioner of Health, with the suggestion that he facilitates the issuing of special that identify her to the transit to and from work, also to ease the screening for security officers at checkpoints to be able to identify who is who.